Todd Houghton here from Houghton Physical Therapy. Excited to be here for another session of Facebook Live, the PT Perspective. I'm really excited to be here tonight talking about one of my favorite topics that I've been seeing lately in the clinic here for physical therapy. So what I really wanted to talk about was removing unnecessary stress in your life and how can it help you overcoming chronic pain, chronic injuries, or chronic sports injuries. So 3 important topics that we're going to go over throughout the night. Number 1, motion is lotion. You got to remember to keep moving. Whether you have chronic pain, chronic injuries, chronic sports injuries, we never want to stop moving. Going in bed and lying down or taking 3 weeks off is not going to help anything whatsoever. We know that motion is lotion, number 1. Number 2 is we want to improve circulation. So we want to improve circulation, which will increase dilation, increase circulation, increase dilation of the blood vessels in the body through movement equals better health. No question, better health. It increases the ability for the body to get rid of more inflammation. It also speeds up the healing process, which is a very important point. Believe it or not, your improved posture and your body language, standing up tall with good body position, shoulders back, head up, a smile on your face, believe it or not, goes a long way. Whenever we come into a slouch posture position, what we do find is that turns off the fuse box, and we turn off the fuse box, we know from my past talks related to it affects the nerve, and when we affect the nerves, we'll get more pain, we could have numbness and tingling, and we shut off the muscles and the power source to the muscles, meaning that different parts of our body are weaker. When you sit up tall and confident with change, your body physiology completely changes and your body can relax because it's in good alignment. Studies have shown that chronic pain might not only be caused by physical injuries, but also by stress and emotional issues. Big, important piece. Also, people that have experienced trauma in their past, suffer from post-traumatic stress, PTSD, are at a higher risk for developing chronic pain. 15 to 30% higher. That's a pretty significant number. So what is emotional trauma or physical trauma? I'm going to define that as is when our ability to respond to a perceived threat in some way, emotional or physical, becomes overwhelming. You feel overwhelmed. We can feel overwhelmed in life. We can feel overwhelmed physical-wise, and that can cause a trauma. When your body becomes overwhelmed, it releases a lot of chemicals that aren't really great. Over the long term, they're not great. One of them is cortisol. And over time, when we release so much cortisol through the fight or flight, always being on edge and always being stressful, it gets into our body and it causes inflammation. And the body has a hard time ridding of the chemicals that it creates that the body doesn't need anymore. So during a traumatic event, the nervous system goes into survival mode. And sometimes it is difficult to reverting back to its normal mode, especially when it's used to being always on high alert all the time. Again, if you stay in the survival mode, then the hormones get increased in the body, the ones that maybe aren't so great, on a consistent basis. They can cause an increase in what? An increase in blood pressure. Not really a great idea. Increase in blood sugar, and it can also, most importantly, is it reduces the ability, the body's ability to heal. And also, the physical symptoms start to come out: neck pain, shoulder pain, the weight of everybody on my shoulder, and those physical symptoms start to manifest when you're in constant distress. So pretty much the topic for tonight: what is chronic pain? Chronic pain is defined as prolonged physical pain that lasts for longer than the natural healing process should allow. A lot of people have chronic pain. The pain can stem from injuries, inflammation, neuralgias, neuropathies, and some people even suffer from an absence of any of these conditions. It can really debilitate the body's position or the body's ability to move, may hinder normal functioning, and then they might search for other things like medication to help with the relief, causing addictions, which just compounds the problem. Chronic pain is also accompanied by feelings of hopelessness, depression, and anxiety, which we'll hear a little bit about what that causes later on down the line. Often these physical pains kind of warn us that something's coming and we need to take better control of what's going on in our life. So what is the connection with chronic pain and patient with overuse injuries? When physical symptoms start to manifest in the body, when the body is under constant distress, that is likely what we see in overuse injuries. So chronic injuries can sometimes lead to chronic pain. I'm going to say my perspective over the last 24 years of treating patients is I'm going to say every single person with 100% certainty has some type of emotional distress or whatever, pain that's come on, at least adding to a piece of what they're coming in for physical therapy in the physical sense. So if we can find out what is the mindset that we need to address, what might be some trauma that that might have happened in the past, any stressor in life, when we can find out maybe what the stressor in life is through our conversations, if we can help that will always help out the physical body for whatever the person was coming in here for. So what would I, Todd the physical therapist, see objectively when I come in and a patient comes in to see me? Well, we already know that emotional stress can lead to stomach aches, irritable bowel, headaches, and then sometimes things are a little bit harder to diagnose because they really present as a shoulder issue or a neck issue because of any physical stress, emotional stress that's going on. Some signs of the physical and emotional stress that I might see is anxiety, depression, digestive problems, headaches, heart disease, sleep problems, weight gain, memory and concentration issues. Chronic signs of worry and emotional stress is the fight or flight response. Again, that leads to increased cortisol, sits in the muscle soreness, and then leads to an activity because we're sore and we're tired. So what are the long-term effects of anxiety? Increased muscle tension. My neck hurts, my trap hurts. We get the pain, spasm, pain cycle. We have pain, spasm, more pain, spasm. That's one of the things that we really want to break in physical therapy is how do we break the pain, spasm, pain cycle? Also might see headaches and insomnia. When somebody can't sleep, they cannot heal. Rest is super important. The long-term stress of anxiety, long-term stress and anxiety will lead to depression. Depression leads to a slouched posture, poor body language, and a decreased exercise level, which is a recipe for a disaster. Again, what did we talk about before? Motion is lotion. Improve your circulation, dilating all the blood vessels in the body, help clear out the inflammation, improve your posture and body language. That's where we want to go. So what can we do? What can we do? Well, there's plenty we can do, whether we have chronic pain, chronic sports injuries, there's plenty we can do. From a medical perspective, there is definitely, you read any of the studies out there right now, a strong correlation between chronic pain and emotional ties to that. So what do we want? I'm going to say two things. A combination of physical therapy in which we're going to really educate the patient about their diagnosis. We're going to go over their whole kind of body, their whole life, and kind of what is the balance looking like in their life right now. Where are they emotionally? Where are they at work? Where are they with their kids and family? How are the different stressors maybe impacting their ability to either complete the home exercise program or to be able to get to the gym or to be able to get on a walking program? So those all really play together. So after the patient education, we want to come up with a good treatment plan that the patient is going to feel good about following. The core exercise program, what we're going to do is going to address all your posture lifts, shoulders back, engaging the abs, engaging the core, engaging the glutes, making sure that we're activating the right muscles all the time. Also might be helpful to have an accountability partner to help you stay motivated through this process, whether you're going to the gym or doing your physical therapy exercises. The next thing is a therapist. Maybe you want to go talk to somebody. Maybe you can talk to someone that would be the most logical pain management, knowing that there's definitely an emotional tie to this. So that would also be something you might want to consider doing. How do we break out of this chronic pain pattern? My favorite topic, mindset. So we know that, so when we look at the mindset, we know that we want to move. We want to change our physiology. Number one, move. Move. Even if you're sore, you're tired, it's raining out, it's not raining out, find some way to make that happen. Motion is lotion, period. Make a plan to stay active every day, even if you don't want to. We've got to stay committed to the process. Number 2, change your focus. What can you do to help this? Who is an expert in the field that you can maybe go see or help out with? I know that this is good for me, so I know I'm going to have my focus that if I keep doing this, I'm going to feel better. Then we want to give it a different language. Even though I don't feel so good today, I know by doing these exercises, I'm going to maybe be able to walk a little bit farther. Tomorrow I'll be able to hold my granddaughter or grandson. There's lots of positives that we can come up with. That's if we do stick with the program. Also make one if we don't stick with the program, what's going to happen? I might have heart issues, I might get diabetes. So we want to give it a different language if we do it and if we don't do it. That's the mindset piece. For the physical piece, again, number 1, what is it? We should know by now, motion is lotion. Get moving, daily rituals. Walking, swimming, gym, ask a friend to join you, buddies, accountability partners, join a training group, join a gym where you can take group classes. So get moving. Number 2, your posture and your body language. It's everything. It's most of the communication, 80-90% of communication. Practice smiling in the mirror, believe it or not. It's actually pretty fun to do, and it will get you in a good mood right away. Even get up and try that right now. Stand up nice and tall, with a good position, put your shoulders back, smile. It makes you smile automatically. You can't not smile. Third one is just a little bit of self-care and self-love. You want to do things that make you smile. You want to do things that make you laugh. You want to do things that make you happy. And also, very important, surround yourself by like-minded people. Only have people in your life that are going to add value, and you can add value to them as well. So hopefully that was helpful for you all tonight. This is definitely one of my topics that I enjoy talking about, so we can make a big change and help a lot of people out. Look forward to seeing you next week. Have a great week.